Well, good afternoon. I have brought my frog voice, or somebody said my radio voice, to the meeting today, so hopefully you enjoy it. With that, I'd ask you to please rise, and I would ask Chaplain Joyce Johnson to lead us in the invocation.
Shall we pray? May you bless all who are here today, endeavoring to direct Sarasota Memorial Healthcare System for the good of all those who are admitted, as well as for the good of our community. This institution has been a shining star, leading to the best health care available, and each time this board comes together, they continue to evaluate and look to the future. Touch each and every one again today as decisions are made to stay the course chosen. Amen.
Thank you. Lead me to the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Let me call this meeting to order, and before we get started here, let me read a public comment statement. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary, who's seated over here. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation to bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discussions or negotiate claims at this meeting. Thank you. All right. Let me get myself organized here. There is a proposed amendment to the orders of the day. Ray Carter.
Okay, I move to amend the orders of the day to remove item 9A2 from consideration. It will likely be back on the agenda next month.
Alrighty. Well, thank you. Can I also ask for an approval of the order? Oh, I apologize. That's a motion. I got it. Is there a second?
Second.
Any discussion? All those in favor of the motion, please signify by saying yes.
Yes.
Opposed, no? All right. Thank you. Now, can I ask for an approval to the orders of the day as amended?
I move approval.
Motion to approve.
All right. Second? All righty. We'll get this crowd lubricated.
Oh,
Let's
second.
get them going. I'm the one with the voice, remember? Alrighty. Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no? Alrighty. Thank you. All right. Next, you ready for this? Okay. Can I ask for a motion to approve the minutes from the December 17th board meeting?
So move.
Second.
All right. Any discussion, corrections, or deletions? All those in favor signify by saying yes.
Yes.
Opposed, no? Thank you. All right. There are no board reports, so we'll move on. Dr. Seaman, will you introduce Dr. Fox, who is going to lead us in our board presentation today?
Yes, Mr. Chairman. I'd like to introduce Dr. James Fox. He's an interventional cardiologist and cardiology department chair. He's been on staff with us for since 1994. Did his medical school at Midwestern University in Illinois. Did his internship, residency, and fellowship in Hackensack Medical Center in New Jersey. And he maintains board certification in interventional cardiology, cardiovascular disease, and internal medicine, and is here today to give us information and insight into our cardiovascular service accreditations. Thank you, Dr. Fox.
Dr. Fox, you're on.
Thank you. And before I thank you all, thanks for the opportunity to speak for cardiology today. Before I start to go through this, I just want to say thank you to the nursing staff. And I want to introduce the people who really do the work behind the scenes. So if I could, come on up here and take a bow for just a second.
Thank you. I'm Julie Palashik. I'm the nursing director over the neuroprogressive and cardiac progressive units. And I also want to mention Jacqueline Krasuski. She is the cardiovascular program coordinator, and she would really wish she was here today, but she's out ill. So I just wanted to give her mention and thank her for all her hard work, because without her, we couldn't have done this. So.
Thank you.
Thank you. Thanks very much.
I
Thank
thought
you.
you had fully delegated to her. I said, this is,
Well-
man, he's done a great job already.
And since from the last presentation, I gave her the clicker.
Oh, there
As
you
you
go.
remember, the last time I had so much trouble at the medical exam. Thank you, yeah. So, Department of Cardiology, doctors in private practice, the department's been, I've been involved with it since 1994, and we were approached to seek accreditations for the department as part of the programs we already had in place. I'll just take a minute to give you just some insight into our thinking on that. Is that I come from a generation, my mom and dad were both doctors, and back then we were doctors and physicians and not healthcare providers. And doctors never advertised. You know, if you were a good doctor, the guys who referred you cases found out about it, patients by word of mouth sent word, and your private practice grew over time. Doctors who put ads in the newspaper were kind of frowned upon as guys that couldn't do well. And so we've had some reluctance in the department over the years to go out and to promote ourselves or to market ourselves, quite frankly. But we've evolved that thinking. We understand that times have changed. Marketing's important. It's important for the hospital. It's also important from a regulatory point of view and to standardize ourselves against metrics that are accepted nationally. We think that's been a good process. We wouldn't have done it if we hadn't been approached by these great nurses. Anyway, these are the results that we got from that. Cardiovascular Center of Excellence, we attained that in June of 2018, the first in the state and the fourth in the country. Overarching accreditation focuses on comprehensive care. The governance is interdisciplinary team approach, which we have always stressed, an important part of how cardiology has worked with all different departments as well as all different parts of the hospital, whether it's the cath lab or the emergency room, the intensive care units, pulmonary. Policies created to span the growth systems of care. We have to have 6 community-sponsored events, biannual regional initiatives, onboarding staff education, which I don't do too much with, but they do, annual staff competencies, which are checked, data-driven initiatives, and translate guidelines into practice. I've been doing that for years, so that's a continuous process improvement. So that's when you look at the ACC data and take a look and say, well, gee whiz, what are we doing right or what are we doing wrong? If we're not getting patients up from the emergency room within 90 minutes for an acute MI, why was that problem? Was it EKG, door to EKG time? Was it EKG to call time? Where was the process? And then implement that change so that we continue to meet the high standards which we have to accomplish that goal. And that's, of course, the national average, to get patients with an acute MI, whether from here, from Northport, or from any place, to the cath lab within 90 minutes. So we received that award. We think that's a good award. The one we're most proud of is the American College of Cardiology Award, which is, of course, what we're involved in. We're the first ones in the county to have full accreditation in that. Transition of care, and that's if a patient is in the emergency room and has had chest pain and we send them home and we say it's not really cardiac chest pain, we don't think so, do they get to a cardiologist or see a physician within 48 hours? And phone calls to follow up on that has been a big step forward. Social barriers to care, whether or not it's cost, language, whatever we have to do to overcome that problem. Community outreach for early signs and symptoms of a heart attack, always been a strong part of what we try to do. Live hands only CPR, what was that, 2,600? I don't know how many they did. High school students, I think, were trained in that with collaboration with the Sarasota County Fire Department and the Sarasota School District. Specialty nurses, congestive heart failure, neuro, all the different nurses that we have at the bedside to try to help teach patients smoking cessation, develop individualized goals of care, keeping patients under a certain weight for heart failure, making certain that they meet their dietary goals, making sure that they make lifestyle changes as far as tobacco goes. And then again, the focus on continuous process improvement, monthly data collection analysis. The department has a monthly cardiology data review committee in addition to privileging committee and quality improvement and monthly department meetings, which you're all invited to anytime you want to come. Thursday morning, 7 o'clock, 3C, we're there. And how we then translate the guidelines into practice and different parameters that we try to change. Give you an idea of what we're doing now is we're working on transesophageal echocardiogram to meet ICAO certification. So we have some work to do on that. So it's an ongoing process which we're always involved in. And it's our goal for all of our different, whether it's nuclear cardiology, EKG reading, to meet the guidelines that are set nationally. Give you an idea of what we do. This is sort of the engine room, what you're familiar with in terms of interventional cardiology. 3,550 cardiac catheterizations fiscal year 2018, 1,100 percutaneous coronary interventions, balloon angioplasty, rotablator, however we're going to open a coronary artery. Took care of 165 acute MIs through the emergency room. Defibrillator placement, the electronic devices that are placed in someone to help if they have a fatal arrhythmia, to correct that arrhythmia of pacing or to deliver a shock to convert their rhythm. Pacemakers, patients who have slow heartbeats, who require sort of a floor to their base heart rate. Ablations, 1,030, an area of growing utilization both for atrial fibrillation, which most of you are aware of, also for ventricular arrhythmias, supraventricular arrhythmias. We have a good staff of ablaters, and we have even better staff of staff, I think, now. The facilities are good. I think the EP labs are very strong, and we've had good placement there. TAVR, which anybody who knows me, and when I speak, I always make sure that everybody understands that TAVR is a cardiology procedure. Every valve is placed by a cardiologist. Mitral clip, 20. At this point in its evolution, it's a clip to try to place on the mitral valve to reduce the redundancy of the leaflets and reduce the amount of mitral regurgitation. A heroic bailout measure right now. It's done by doctors Mumma and Uriura. I think over time that will grow a great deal as prosthetic mitral valves come in, and they'll be balloon mounted. That's sort of the future. Watchman, 106. Those are for people who can't take anticoagulation for a variety of reasons, either falls, GI bleeding, neurologic events, who are at continuous stroke risk because of chronic atrial fibrillation. We put a net, if you will, into their left atrium and try to occlude it so that clot cannot come out. Patent Framo Valley, structural heart disease, where we correct a hole in the top part of the heart. Peripheral interventions, carotid angioplasty. We participate in all the different databases, ACC, the registry outcomes, the AFib registry. So we are in all of the major databases, and we have an excellent data collection team, and it provides us with a lot of guidance on keeping the program to the highest levels. And again, we met all of those, or we wouldn't have gotten this accreditation. Treated over 700 MI patients. Again, not everybody has a classic MI presentation. Evaluated 3,200 for chest pain. Unnecessary 30-day admission rates for acute MI. Top 3 lowest or best in the state of Florida. Top 24 lowest, best in the nation. In other words, people not coming back to the hospital and treated successfully. Heart failure, top 3 lowest readmission rate in Florida. We have a congestive heart failure clinic. Mike Mum is the medical director there, does a great job. And also all the nurses there. Really does a good job keeping people out, coming back to the hospital. Sarasota Memorial has never been penalized for readmissions. It means something to me. It means a great deal to you as an institution, I think. I think that's an important thing. Outperformed like hospitals in key categories for mortality rate, percentage of patients receiving appropriate discharge medication, and percentage of heart attack victims receiving treatment within 90 days of arrival. It's really a small snapshot of everything that we look at, these awards, because we look at so many other things where we do quite well. I just went over the premier data for the department. It was great. Met or exceeded all parameters for that. It's really, the program is really outstanding, and it's in a very good place. I mean, I've been doing this since '94. I think I wrote the first rules of the department in '95. So I've been working at this for a long time, and I was the first cath lab director here, and I've been banging away at this. But the program and the surgical program are in a really good place. So I'm pleased that we have these accreditations to report. Thank you all very much for your support. And our goals for 2019 are to increase community presence, access community resources in Venice, which is, goes without saying, and expanding cardiovascular support in some of the outreach programs that really Julie is responsible for. I think that's all I have to say today. Hard to believe.
Thank you, Doctor.
I'm Gabby, so if I can answer any questions, I'm happy to do it.
Any questions for Doc? Well, on a personal basis, thank you for
My
what
pleasure.
you've done.
Thank you for your
But
time.
on a group basis, your leadership and really the coordination between yourselves and the surgeons have made this place a destination for any kind of cardiac care, so thank you.
Well, thank you. And the secret, of course, is that the dirty little secret is that good doctors like to work with good doctors. So it's been my privilege to work with the doctors here at this hospital. We have a spectacular group of doctors. You know, in the ICU, does a great job, you know that. And all the doctors across the hospital. It's a pleasure to work here, really. Thank you.
Thank you, Doctor.
Thank you.
Good hospital administrators like good doctors too, like Dr.
I would
Fox.
imagine.
All right.
I would imagine. And good doctors help attract more good doctors, so that's even better yet. All right, let's transition over to our monthly awards. And David, I understand you have a few.
I have a few. So I'd like to first welcome Jen Bonham up as our December 2018 Excel Award winner. Jen? Come stand by me. Make me look good. So Jen is Bonham is who is a PhD, so Dr. Bonham, okay, is our December Excel Award winner. She's a nursing professional development research specialist in the education department, and she's been with Sarasota Memorial since 2001. Jen's colleagues describe her as an energizing nurse educator with extraordinary commitment and effectiveness. Jen is very supportive of our nurses and staff, they say. We affectionately call her the EBP Queen, a title she earned for outstanding work mentoring nurses in evidence-based practice. Her colleagues and coworkers also say she is passionate about research, inspiring them to participate in committees, write grants, and present at conferences. Jen's nominations agree that she's an invaluable resource. She's positive and engaging, and a real force of nature. Doctor, congratulations. Thank you so much.
Our Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They're superior performers that make an extra effort in the quality and care of our patients and families in the community. The Hospital Board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Jen, with the Excel Award for the month of December 2018. Thank you for your continued dedication to excellence, and it's signed by David Barrender, our CEO, and Joe DiVirgilio as the chair. Thank you very much, and congratulations.
Jen, your speech time. I'll hold it for you.
Oh, thank
I don't want you
you.
to drop my foot on me.
Thank you for that. See, he just keeps on giving. Well, it's been a huge honor to receive this award. I love my job. I love to work here at this hospital. There's nowhere else in this area I would be. I'm grateful for all of the support, getting my PhD with amazing tuition reimbursement, the colleagues that I work with who are so full of intelligence and caring that we do meaningful and valuable work in this community. So, I mean, truly, I'm grateful. And it was awesome to have the cherry parking spot in the entire month of December. That was fantastic, too. So thank you very much.
Thank you. Congratulations. Should I continue, Mr. Chair?
You shall continue.
Okay, now I get to have the pleasure of introducing our Excel Award winner for January 2019, Ms. Karen Marshall. Come on down.
I think we brought a tear to her eye. Gotcha.
A little bit.
There you go.
So Karen Marshall is our January Excel Award winner. She's an assistant to the hospital board, as you may know, and has been with Sarasota Memorial since 2001. Karen, the den mother. She's had some of the hardest jobs in this place. I'm going to go off script for a second. She was Peter Taylor's assistant, then she was mine, and now she's yours. You know? So, Karen serves as liaison for our 9-member board and hospital administration, physicians, and staff. Her coworkers describe Karen as someone who has specialized skills for many demands of her job. For example, communication. Karen has an important role in keeping everyone informed, her coworkers say. Whether it's by phone, in person, by mail, email, or otherwise, you can count on her to get it done. Attention to detail. Karen's ability to multitask the board members' individuals' requests and scheduling needs is second to none. She's rarely absent and always willing to jump in with a positive attitude and help whenever needed. And trust. The board truly relies on Karen's rock-solid support, her coworkers say. They know her as a compassionate, trusted resource who strives to consistently get everything just right for them. Karen, thank you for everything you do.
Thank you.
Congratulations.
The Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare System recognizes you, Karen, with the Excel Award for the month of January 2019. Thank you for your continued dedication to excellence, and it's signed by David Verinder and Joe DiVirgilio as the chair. And I think that the board, I know, appreciates what you do, and it's a privilege to present this to you. Congratulations.
Thank you.
No, you have to say a few words.
Oh, and I need this back, too. You haven't gone to management council yet.
You get to do this again.
Oh, yay. Thank you all. Today is actually the anniversary of the day I started working here at SMH. And I can't think of a more perfect way to celebrate that. So I have a great team that I work with, and I'm fortunate to work with all of you on the board, and thank you.
Shall I continue, Mr. Chairman?
You shall continue.
We are honored today to also, as we do ever so often, get to recognize a Hero Award. So I'd like to invite Tara Green up for our January 2019 Hero Award. Tara? I'm going to talk good about you.
Okay.
You ready?
I'm
All
on
right.
board.
Tara Green is our Hero Award recipient for this month. Tara is a registered nurse on 5 Aldermere Tower. While shopping with her young daughter last month, Tara turned down an aisle and spotted someone collapsed, face down on the concrete floor. She quickly assessed that the person was not only unconscious but had no pulse. Tara immediately started CPR and was soon joined by another nurse who also had been shopping. Someone quickly brought them to the store's automated external defibrillator, and together the nurses administered both AED shocks and CPR until EMS arrived. Shortly afterward, in transport to the hospital, an EMT informed Tara that the pulse was successfully reestablished and the patient was regaining consciousness. Thank you, Tara, for everything you do.
Hero Hall of Fame. The hospital board and administrative staff of Sarasota Memorial Healthcare System hereby induct you, Tara, into the Team SMH Hall of Fame, Hero Hall of Fame, for actions that capture the essence of a true hero, including courage to have persistency in the face of fear, passion to always do the right thing, integrity to have a strong moral compass, and concern to have concern for the well-being of others. And it's signed by David Verinder, the President CEO, and Joe DiVirgilio, our Chair of the Board. Congratulations. Can you say a couple words? Tara, I'm going to hold this for you because we're going to embarrass you again at Management Council, so I'll
Okay.
give it to you back to you.
I want to thank the board for recognizing my efforts, and it's truly an honor to have had this opportunity to save a member of our community. And while I think that you get recognized as a hero, I think any nurse that I worked with on 5 Wally would definitely have done the same thing. So it's just part of who we do, who we are. Thanks.
There you go. And with that, we've cleared the room.
So who's left?
All righty. Next up, we have the report of the medical staff. Dr. Seaman.
Yes, I have a few motions for the board today. I'll take them one at a time, if that's okay, Mr. Chair.
Hold on one second, Joe. I think Sharon's given the
Okay.
motions today,
Okay.
if you don't mind.
No, please proceed.
And I will proceed, and I will take them one at a time as well.
There you go.
The first one is, I move approval of the internal medicine PGY 1, 2, and residency training program scope and procedures as recommended by the Medical Executive Committee.
Do we have a second?
Second.
Any discussion? All those in favor signify by saying yes. Yes. Opposed, no? Okay.
The second motion is, I move approval of the clinical supervision definitions for residents and advanced practice professionals as recommended by the Medical Executive Committee.
Do we have a second?
Second.
Discussion? All those in favor signify by saying yes.
Yes.
Opposed, no?
And the third motion is, I move approval of the criteria for the electromagnetic navigational bronchoscopy for pulmonary medicine and cardiothoracic surgery as recommended by the Medical Executive Committee.
Second?
Second.
Discussion? All those in favor signify by saying yes.
Yes.
Opposed, no? Thank you. Anything else?
That is the end of my proposals and motions,
Okay.
Mr. Chairman.
Thank you. Dr. Seaman, anything further from the
No,
medical
thank you
staff?
very much, and
All
sorry
right,
about
thanks.
the little,
Don't worry about it. We have
That's
a
okay.
whole
We're
bunch of
good
newbies
team.
in different roles today, so we'll get it. We got 11 months to practice.
Okay.
There you go. All right. Good, thank you. Mason Ayers, Foundation Report, and side comment. Fantastic gala.
Well, good. Well, thank you. I wanted to thank everyone for being part of it. It was an amazing night in so many ways. Our preliminary numbers show that we're kind of tracking towards over $1.2 million raised that evening for
Outstanding.
the SMH Cardiac Services Program, which is awesome. It was an incredible team effort between the foundation and the hospital. I do want to recognize a couple folks on our team that really went above and beyond, Sally Schul and Rachel Williamson. Under their leadership, they were able to host an event like that, and it was wonderful. So thank you all for being there. Also, make sure you mark your calendars for January 11th, 2020. We're going to do it again at the Ritz. And also, I wanted to let you know that our next event coming up on the calendar is Friday, March 29th, which will be our Women in Medicine educational luncheon. It's going to be held at Michael's on East. The beneficiary of the luncheon is going to be the internal medicine program, GME. So I hope you all will be able to be part of that. And that concludes my report.
Great, thank you, Mason. It was a beautiful evening, thank you. Greg Carter, Secretary's Report.
Thank you, Mr. Chairman. Our schedule for next month is, we will meet on Tuesday, February 19th, starting at 9 o'clock with the Mission and Planning Committee. At 10:30, we'll have the Investment Committee, and then at noon, we'll do the closed session for the hospital board meeting. And at 12:30, we'll have our board lunch with issues and financial review during that. And at 2 o'clock, we'll have the board meeting. And that concludes my report.
Thank you, Greg. Next up is the Treasurer's Report. Sharon Wetzler, D. Peters.
Yes, I have a motion. I move approval of the bad debts and charity care for the month ended December 31st, 2018, in the amount of $18,253,000.
Second.
The motion is second. I don't think there's any corrections needed, so all those in favor of the motion, please signify by saying yes.
Yes.
Opposed, no. Great, thank you very much. All right, with that, we transition over to the financial highlights. Bill Wojin, CFO.
Thank you, Mr. Chairman. I have the highlights for the month of December. So for the system, we'll start with operating revenue. For the month of December, we had operating revenue of $81,106,000 compared to a budget of $73,255,000. fiscal year to date, and this encompasses our first fiscal quarter, 3 months, actual revenue of $228,296,000 compared to a budget of $213,055,000. For the system's total expenses for the month of December, $72,155,000 compared to a budget of $70,641,000. Fiscal year to date, $213,478,000 compared to the budget of $209,746,000. Looking at operating income in the rating agency format for the system, and this is for the month of December, $12,927,000, operating margin of 15%, comparing very favorably to the budget of $6,540,000. We budgeted an operating margin of 8.4%. For the first fiscal quarter, operating income of $26,835,000 for an operating margin of 11.1%, compared to the budget of $15,085,000. We budgeted an operating margin of 6.6%. For the hospital's statistics, we'll start with average daily occupancy. For the first quarter, this is 3 months of activity, 534 patients compared to a budget of 504 patients. The average acute length of stay is 4.3 days. Last year it was 4.37 days. Admissions so far, we have 9,551, comparing very favorably to the budget of 8,878. Surgery cases, 6,033 in the first 3 months, compared to a budget of 6,008. And births, we have 977 compared to a budget of 915. The hospital's outpatient registrations for the first 3 months, 113,713 compared to the budget of 114,486. And emergency care registrations, combined our two emergency care centers, 30,947 compared to a budget of 30,675. And so far for 3 months, our case mix index for all patients is 1.92, and for Medicare patients, 1.94. Mr. Chairman, that concludes my report. Unless there are any
Any
questions.
questions for Bill? Thank you, Bill. Appreciate it. Let's move over to committee reports, and we're going to start off with the Joint Financial and Audit Committee and Tram Hudson.
Mr. Chairman, we met this morning in a combined session of the Audit and Finance Committee. We had a full agenda, approved both the minutes from November 20th for the Finance Committee and the minutes from the October 15th Audit Committee meeting. Our first presentation was by the accountants from the CPA firm of KPMG. Todd Webster and Julia Safina presented the draft results of the audit of the FY18 financial statements for the district. They reported that the audit went well, and they summarized the numbers at September 30th, 2018. They also reported on significant audit areas and management judgments and estimates used in the preparation of the financial statements. Those financial statements will soon be issued, and they will carry an unqualified opinion. I have a motion that I would like to propose, is that I move acceptance of the audit of the FY 2018 financial statements of the district as recommended by the Finance and Audit Committee.
Motion and a second. Any discussion? All those in favor signify by saying yes. Yes.
Yes.
Opposed, no. Ready, thank you.
Our second item was a presentation by Maureen Pingree, a partner with the Bobbitt Pittenger and Company CPA firm. They presented the draft results of the audit of the FY 2018 financial statements of the SMH Healthcare Retirement Plan. They reported that the audit went well, and they summarized the numbers at September 30th, 2018. Also reported on significant audit areas, management judgments, and estimates used in the preparation of the financial statements. The plan significantly was approximately 98% funded as of September 30th, 2018. Their statements will be issued here shortly, and it will also carry an unqualified opinion. And I have a motion. I move acceptance of the audit of the FY 2018 financial statements of the SMH Healthcare Retirement Plan as recommended by the Finance and Audit Committees.
We have a motion and a second. Any questions? All those in favor signify by saying yes.
Yes.
Opposed, no. Okay.
The third item, we met with John Salt, presented the selection committee rankings for the design build of the new parking structure at 1741 Main Street, which is the new office building that actually we closed on today. And I have a motion for that. I move approval of selections for professionals for the design and construction of the parking structure at the Support Services Building at 1741 Main as ranked by the committee in the public selection process and recommended by the Finance Committee as follows. Number 1, A.D. Morgan. Number 2, J2 Solutions. And number 3, Creative Contractors.
We have a second.
Second.
Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no.
On the fourth item on our agenda, it was a busy morning. Tom Perigo presented the selection committee rankings for the SMH Venice Building Code Plan Review and Inspection Services. And I have a motion I'd like to present. I move approval of selections for Building Code Plan Review and Inspection Services for SMH Venice as ranked by the committee in the public selection process and recommended by the Finance Committee as follows. Number 1, TLC Engineering for Architecture. Number 2, Calvin Giordano and Associates, Inc. And number 3, GFA International.
We have a second. Second. Any discussion? All those in favor signify by saying yes.
Yes.
Opposed, no.
And finally, we had a presentation by Mark Thornton. He provided an update on internal audit projects completed during the first quarter, including the Smart Plan 2018, the FEMA applications regarding our application to have expenses reimbursed for Hurricane Irma, the IT integrity controls, auditing and monitoring program on the Sunrise Clinical Manager overrides, and a special presentation on time to code pink. There's no motion necessary for this, is only information only. And that concludes my report, Mr. Chairman.
You earned your keep today.
I did. They worked hard.
There
Anyway,
you go. Well, thank you
Mark-
very much, Chairman. Appreciate
Super.
it. The other committee meeting we had today was Quality Committee. Sharon Peters.
Yes, Mr. Chairman, because the board holds closed sessions of the Quality Committee, I have nothing to report.
All right. Thank you. Thank you. Next up is our president, with David Varian, President and CEO, with our president's report. David.
Thank you, Mr. Chairman. I'm going to start as I do with each meeting with a look at our organizational report card. This is for our first quarter, ending this past December 2019. Our fiscal year to date in 2019. We start by looking at our service pillar. We have a goal of having our system patient experience, or likelihood of recommending the number of service areas equal to or greater than the 75th percentile. We have a goal of having 8 out of 10 of those meeting that. Happy to report we are hitting that at 8 out of 10. I'll show you some detail here in a minute.
And that's improvement over last month. Very good.
It is.
Yes.
Thank you for noticing. It was a lot of hard work by a lot of people here. In our people pillar, we have our goal of having our turnover of part-time and full-time employees that have been hired within the past 12 months at 24% or less. I'm happy to report we're hitting that goal as well at 21.14%, which I believe is probably an all-time low for us. In the quality pillar, we have our goal of having the infection prevention, which is our overall combined overall standardized infection rate of being 0.93 or less. Happy to report we're exceeding that as well at 0.71. And when you consider national average being 1.0 or expected 1.0, we are greatly exceeding that. So congrats to all of our team for that. Our finance pillar, CFO Bill Wojcik has already reviewed that, but we have a goal of having our operating margin being 6.5% or higher. We are tracking for the year to be 7.6%, so meeting that goal as well. In the growth pillar, we have two goals. The first being our inpatient admissions and observation outpatients, goal of being for the year 46,070. We are anticipating are tracking to beat that at 51,068. And our second is outpatient registrations. We have a goal of being at 894,000. We are tracking just a little bit slight of that at 891,000. So more to come as the year develops. Looking at a little bit more detail and the likelihood of recommending, once again, we had 8 out of our 10 areas at or equal to or exceeding the 75th percentile. The 2 areas that are close but not quite there, just like 1 point off, are ambulatory surgery and emergency care in Northport. But I would say that's a very good report. Looking at our service pillar, this is changing lives one step at a time. Our Sarasota resident, Bill McClintock, enjoyed a special gift for the holidays after orthopedic surgeon Adam Bright and SMH teamed up to provide him with a free knee replacement. Bill was one of about 30 patients across the nation who received free joint replacements as part of Operation Walk USA, which helps coordinate free knee and hip surgeries for people in need. Dr. Bright and Sarasota Memorial's Community Specialty Clinic have provided free joint replacements during Operation Walk and on an ongoing basis to qualifying patients throughout the year. So we do want to thank Dr. Bright for his work in this. Staying in service, our cancer care collaboration is honored. Our Cancer Care Resource Network recently recognized Sarasota Memorial for its collaboration with the Jewish Family and Children's Services of the Suncoast to provide dedicated wellness and exercise classes for cancer patients, family members, and caregivers at SMH's Health Fit Center. Classes are designed specifically to combat the side effect of cancer and promote personal wellness. So thank you so much for all the people participating in this. In the quality section, SMH is Sarasota County's first accredited chest pain center and primary PCI and resuscitation. The American College of Cardiology has awarded Sarasota Memorial full accreditation as a designated chest pain center with primary PCI and resuscitation for demonstrated expertise in treating patients with chest pain. SMH is the first hospital in Sarasota County to receive the highest level designation, which followed a rigorous on-site evaluation of the staff's ability to treat patients who may be experiencing a heart attack or cardiac arrest. Staying in quality, our internal medicine residency program earns continued accreditation. The internal medicine residency program at Sarasota Memorial Hospital, in conjunction with Florida State University College of Medicine, recently received continued accreditation from the Accreditation Council for Graduate Medical Education, along with multiple commendations during its latest assessment. Continued accreditation with numerous commendations and no citations is the best possible outcome. You know, I'll tell you a little bit in addition to that. The letter we got with the commendations was the most accommodations we know to exist. So congratulations to Dr. Visa Ramesh and Dr. Hammond for their hard work in making that happen. Staying in quality, our new robot targets hard-to-reach lung cancer. So Sarasota Memorial is one of just 10 hospitals in the United States slated to deploy its new technology to help diagnose lung cancer at an earlier, more treatable stages. The new robot, part of our Auris Health's Monarch platform, includes a flexible robotic endoscope and the doctors that use to navigate and search the delicate, distant branches of the lung to obtain tissue samples from hard-to-reach areas for biopsy. The advanced technology provides improved diagnosis and treatment techniques for lung cancer, one of the priority focuses for SMH's Cancer Institute. And we'd like to thank our own Dr. Seaman for going out and getting accredited, getting training for this, bringing it back here along with Dr. Chomiak, and putting it to use for our patients. Thank you, Joe. And nice picture, by the way, in the paper.
Nice beard.
So I don't guess that's ever going to get old, Joe. Okay.
And something tells me his wife's never going to allow him to forget it either.
No. So in the people section, congratulations to Daisy Award winner Joseph Yedlock, our MSN and RN of Bayside Center for Behavioral Health, who is a recent recipient of the Daisy Award. A recognition to honor SMH nurses who go above and beyond and make extraordinary differences in the lives of the patients and families they serve. Staying in people, many thanks to the countless employees and departments throughout the health system who've donated to organizations benefiting children, families, and seniors for the holiday season. And I got to tell you, this is really one of my favorite things that we do here. We pick families and we overwhelm them with gifts and for less fortunate people. And if you go in that room and you see all the people that participate in all the gifts, it's mesmerizing what goes on. And I just want to thank everyone for coming to the needs that present themselves. In the growth section, last month we opened our new garage, our west parking garage, and added 583 much-needed spaces to the main campus. So some relief on parking, although I know we're very busy and we continue to have a challenge there each and every day. But thank you to the board for providing this and having the foresight to do that. Continuing growth, Healing Spaces campaign is uniquely SMH. Hopefully you've seen a couple of these commercials as they've started to pop up on local television. Sarasota Memorial's main campus and satellite facilities grow to accommodate patient demand. A new multimedia campaign highlights 5 unique spaces that helps patients heal. And you can see the mobility garden, the music therapy studio, the courtyard health fit, and the rehab pavilion gym. As always, we have a lot of free lecture series that go on. I would not think that you could read this very well, but I would encourage you to go onto our website and take a look at all the free lecture classes that we have and opportunities. What I would ask you to do, though, if you do that, is RSVP so we can get a good head count so that we can go on there. But we hope people come out and see those and really get something from it. And that is my report, Mr. Chairman.
Any questions for David? All right, well, thank you.
Thank you.
Anything for consent? Any public comments? No public comments. I'm not sure how much public we got left here. Legal matters? All right. Any other business for this esteemed group?
Just a reminder real quick. I wanted to remind the board that tomorrow at 11 a.m., the Phase 1 Cancer Institute project groundbreaking will take place out at University facility.
10 o'clock. 10 o'clock. Yeah. 10 o'clock. And that's phase 1 of our beginning of our Cancer Institute. All right. Hearing none, we stand adjourned. Thank you.